The Quebec government is backtracking on its plan to send some elementary students back to school. Students in the Montreal region were supposed to return on May 25th, but the Premier now says those students won't be back in class until September. Montreal, of course, is considered the epicenter of the outbreak in Canada, accounting for about a quarter of all COVID-19 cases nationwide. So did the province get ahead of itself in its plan to send kids back to school? Christopher Skeete is the Parliamentary assistant to the Premier for relations with English-speaking Quebecers. He joins us from Laval. Hi, Mr. Skeete. Good to see you again.
Very nice to see you again, Vashi.
Mr. Skeete, last time we spoke, you were planning on sending your kids back to school. Yesterday, of course, Premier Legault announced that schools in the Montreal-area will remain closed until September. What happened?
Well, basically, the system works, right? As you recall, when we spoke, I said, as long as public health gives a green light, I'll be going. Public health said it wasn't a good idea, so therefore no one's going. I think this is an example of the kind of flexibility and agility you need to have in a time of crisis.
I guess my one question is that a few weeks ago when we were speaking, there were already a lot of concerns about the numbers, specifically in Montreal, the spread of the virus in Montreal itself. Did your government get ahead of itself by even trying for this date? Although, to be fair to you, you're right. You did say that if the situation warranted, things could be reversed. But why kind of go there in the first place?
Well, it's very easy to shut down an economy and shut down the world. Everybody just goes home. To reopen it, though, it takes some planning. So in order for everybody to be on the right page, make sure that everything was ready for the kids when they did get back, we had to give them a couple weeks notice. And then it was in that kind of reflection that we were thinking about giving them advance notice. But again, being flexible with the idea that it might not happen. So it was about giving the students and the teachers enough notice to get things ready for the kids' return.
I know Premier Legault was touring Montreal yesterday with the mayor of that city. What specifically is your government doing from the provincial perspective to help out the city of Montreal in trying to deal with the way in which this virus has spread?
Yeah, well, we've talked about the fact that there are two worlds, right? There's the world in seniors' homes, and there's also the reality on the ground in Montreal. So today, the Premier announced $5 million in direct aid for the city of Montreal for them to go out and buy masks in order to help them in certain areas. And we're also donating 1 million masks specifically to help people in low-income housing to make sure that they have access to masks as well. So those are the types of initiatives that we're working on to make sure that people stay safe in Montreal.
I want to talk a bit about the people who work in the CHSLDs. And for our audience outside of Quebec, those are the seniors' homes that you reference. There's been some interesting journalism and expertise offered in the past couple of weeks about why the homes have been hit so hard, but also why it seems to have spread to a lot of the neighborhoods where many of the workers in these homes live. And what we do know, and we know this right across the country, to be honest, is that the people who work in these homes are not highly paid. I know that your province has offered a top-up in conjunction with the federal government for essential workers. Are you considering making that permanent?
Yeah, the Premier said it himself that what we did do when we came to power, Vashi, was we opened up a whole bunch of positions because we knew that was a problem, that there wasn't enough people, that there was a shortage of workers in those areas. So what we did is we allotted a budget amount for these residences to hire personnel. What we didn't do, and this is what later the Premier said was probably the mistake, was we didn't increase the salary. We were planning on doing it because the collective agreements were coming to their finality in the month of March. So we figured, we could have the discussion about increasing their pays at that moment. Really, in retrospect, we should have probably done it right away. And I think that's what happened. There was a whole bunch of positions that were made available, but they weren't being staffed. And of course, they were short-staffed. And I think it hit us right where we were the most vulnerable.
So when you look to the future, especially of the system, the long-term care system in Quebec, do you expect that the increases in salaries are here to stay?
I would say that the Premier has been very clear that that is one of the biggest indicators in order to address the problem. I think these are people who take care of the people who built our country, who built our province. I think they deserve respect. They deserve people who are well paid, people who are qualified, and people who are motivated to be at work.
So the federal portion of the top-up for essential workers expires after 16 weeks. Will that affect anything that happens in Quebec going forward, or will the province continue on with this?
Right now, the plan is to put our money where our mouth is. We have a direct need in these seniors' homes, so we're going to see to it that the people remain motivated and have a reason to show up to work, at least financially. And then we'll put in some more permanent measures later. As I said, the collective agreements are coming to an end shortly. The Premier has already said that he's hoping to get extra money just for those people without considering the whole group. We'll see how those negotiations go. It's always delicate because if you give one party 3% or 2%, the other parties are going to want the same thing. We're trying to make these unions understand that it might be in the interest of our society as a whole to maybe look at nurses and senior care workers at it through a different lens. And that's the kind of thing that we're trying to work on.
I'm wondering what the perspective of your government is if we broaden this out a little bit, because this discussion has been occurring. Obviously, the homes in Ontario and Quebec have been especially hard hit, but it's been occurring right across the country. The federal government has weighed in, has been asked to weigh in. And I'm wondering, although we're in the acute phase of things now, when we're on the other side of it and when we're looking at the systemic issues with long-term care, is your government open, for example, to the federal government parceling a certain amount, like a certain envelope of money for long-term care, but attaching standards or guidelines to it that provinces have to adhere to? So attaching some strings.
Well, as we all know, healthcare is a provincial jurisdiction. What's most concerning is that since the beginning of publicly funded healthcare, Ottawa used to give up to 50% in transfer payments to pay for healthcare. And of course, over the years, with the really deep cuts in the 90s, we're a little bit higher now, but we're about at 22, 23%. That's way too low, Vashi. So I think provinces can do a really good job of taking care of their own citizens. It's just a question of maybe Ottawa being a little bit more present in terms of the financing, maybe back to the original levels.
I guess, though, your government's critics would say, based on the evidence of the last 8 weeks, there are holes in the system in Quebec. There are issues with the system in Quebec. And I'm wondering if you are open to, along with an increase in funding, there being some sort of standard that the federal government imposes on your province. I realize I'm treading a delicate jurisdictional line here, but I'm wondering what your take on that is.
I think your question is a fair one, but on the other side, I do think that all the provinces would agree that funding is not at the level that it should be for such an important jurisdictional cost. If you look at all the things since Confederation, Vashi, all the things that cost the most money, education, infrastructure, healthcare, these are all things that cost the most money, and these are all things that are jurisdictions of the province. And at the same token, it's not something that's always been funded in equal measure with the government of various governments in Ottawa. So I think what we need to do is just sit down, have a conversation with Ottawa, a good faith discussion about what we want to do collectively about this issue. I don't think it's a Quebec-only issue. We were hard hit because our school system, our spring break was earlier, and there are a variety of other factors that have affected us differently. I think we need to have a collective sit down, all of us, and discuss the role of these senior homes and whether or not as a society we want to do a little bit better by these people who built our country. We
had the former health minister, Gaetan Barrette, on a few weeks ago, and he said that if you wanted to equip long-term care homes in Quebec to the same degree that you do hospitals, you'll need to fund healthcare by basically an extra $5 billion a year. Does that sound like an accurate assessment to you?
Well, with all due respect to my colleague, he's also the same guy whose highly centralized approach is sort of what got us in this mess. What we've done in Quebec historically was this restructuring that was very hospital-centric. It didn't really consider senior homes as distinct from hospital settings, and they were not funded in that way, or the highlighting of the funding wasn't done in such a way as to make sure the money flowed there. We have a very hospital-centric system, and I don't think that was very helpful in this situation. But of course, I'm not trying to levy any blame. Nobody could have seen this coming. What we have is a personnel issue. I think it has to do with salaries. And I think this is something that we need to look at very closely very soon. And the Premier has already said he's going to do so.
Okay, I'm out of time. I'll leave it there. Thank you very much, Mr. Skeete, for your time. Appreciate it.
Take care, Vashi, and stay safe.
You too. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.